Hello and welcome to the Impact Series. I'm Charlie Webster, your host, and I hope you've been enjoying the series so far. We really wanted to speak to people that had lived experience around malaria and the fight against malaria. And I'm so pleased to say that we're actually in person. Da da da. And I've got the absolutely wonderful Sherwin Charles with me, the CEO of Goodbye Malaria. You joined as CEO in 2015, but I know that you actually set it up and co-founded it with Robbie Rosen, Kim Lazarus and David Stern back in 2012. So Sherwin, it's great to see you in person because we last saw each other in 2018 at Chogham, which was incredible. We've got matching bracelets on, which is also very important, with which is all about malaria. This is Goodbye Malaria bracelet. So can you tell us how you first started Goodbye Malaria? Because your background's actually finance with Nando's.
Yeah, in fact, before Nando's, spent my life in banking and then had the most amazing, life-changing opportunity to join Nando's. And in 2009, got to meet the United Against Malaria team. David Kine was running it. It was being funded by the Bill and Melinda Gates Foundation. And the aim was to ensure that malaria was the health theme for Africa's first World Cup, 2010 World Cup in South Africa. And so what a wonderful experience, having seen how malaria ravished and killed kids on our continent, to be able to have it highlighted at the World Cup. And so we worked together with the United Against Malaria team. It was our introduction to the Global Fund. And it was a way for us to really first imagine how we could have real impact in the world of malaria. And it started us on this journey that in 2012, as you mentioned, led to the creation of Goodbye Malaria.
A few questions then. So you said about it made you realise what real impact you could have. So what did it teach you and what were your learnings to see what real impact you could have?
We'd seen malaria firsthand in communities around the continent by travelling with Kingsley Holgate. I mean, Africa's
We
premier.
had him on the Impact Series.
Absolutely.
Yeah.
And you know, the journeys he's taken over the years, and we were part of that. And being part of that, I've had experiences with Kingsley across the continent, handing out life-saving bed nets to pregnant mums and families with children under the age of 5. And so we felt, both Robbie and I, that we needed to make a difference. It was great sponsoring Kingsley and together with Vestergaard sponsoring the nets, but how do we do something that's more impactful, that can be measured, and that can really drive us to zero? You know, we've heard so many people speak about wanting to end malaria in their lifetime. And we felt that as Africans who have been part of taking, you know, and building the Nando's world, why can't we have an impact in the world of malaria? And so it was fantastic to start that journey, learning from the UAM team about how to get advocacy around malaria correct, how to bring the celebrities, the football stars into the world to make a difference on the continent. Of course, football on the continent is so important, almost a religion. And it was a great way to get the youngsters interested in the message.
We were actually just discussing before we turned the cameras on about the power of sport and the power of football to educate. Just take you back you said 2 key words. You said measured and you said advocacy. So how important is to make sure that something's measured, but how do you measure advocacy?
I think it's pretty easy, right? If you look at the world of activists, the first thing that comes to mind are HIV activists who've really been out there, been aggressive, have been heard, and made a difference. You then look through the years and you've seen a lot around cancer, but you've never heard about the malaria activists. And I think if our advocacy works, it's when you will hear the stories coming out of the communities, and you would see that community ownership of the solution starts to be in place, as well as that the communities are holding their governments to account, and we're getting the malaria activists coming out of the communities. It's something you said to me a little earlier while we were chatting, is that people in the world of malaria, our people on the continent of Africa, take malaria as a way of life. That needs to end. We need to ensure that people understand this is a disease that can be beaten, that can be eradicated, and we can get to zero. And I think once we get that advocacy right, the behavior change in place, we will succeed. We have all the tools, but this is the missing piece of the solution.
How do you think you get that message across then? Because your background is finance. I think sometimes, we've met at various different, amazing platforms to try and get the world talking about malaria. I know you've done incredible work, but in terms of the behaviour change, a lot of tools are talked about, finance, science, but not necessarily the actual individual or the behaviour change. And just to give some context, I was just telling you that when I spoke to some people in Africa, in Uganda, they were like, oh yeah, but it's just something we have to deal with. So how do you shift that?
It's not easy, but it's possible. If I look at the world of Nando's, we have the most incredible advertising campaigns.
Yeah.
We've brought peri peri to the world. Surely I can ensure that communities start believing they don't need to live with malaria. And I think we've seen that in the work that we do on the ground in Mozambique, Eswatini, and South Africa, where that message is starting to resonate. We in Mozambique are pretty close to having zero local transmission in some districts, unheard of. But the message has got through to the communities that things need to change. And
do you think that's in the key then? Do you think that's been the key thing in those local areas to shift things?
I think it's been a few things. Right. Firstly, it's the ability to create partnerships that work. And part of that was us putting down our money where our mouth is. So it wasn't just us looking for donor money. We'd committed money to the Global Fund, which was then matched by the Bill and Melinda Gates Foundation into a Global Fund grant that then has become a regional grant. And that has made a world of difference. It's allowed us to implement what everybody talks about, mosquitoes knowing no borders. We've managed to implement programs across 3 countries that are all aligned regulations, aligned policies, and aligned the use and tools that the countries would use. And I think that's been part of the success. The second element to it is what will get us across the line is ensuring that implementation of the programs happen timeously. And I think bringing a private sector mindset coupled with the public health expertise of governments, we've been able to achieve that. So it's a story we haven't told properly. It's something we only wanted to discuss once the job was completed. But I think the time has come for us, because there are learnings that other communities can use and adapt for their own fight against malaria. And I think it's critical that those learnings are shared and the understanding of what's led to that success. So it's got to be measured. You've got to understand what the drivers of that has been. And a lot of it is very simple stuff that we sometimes in the private sector take for granted. One of my biggest joys in what we do is that our programs, by not by design, I don't know, but it really is just a way of life for us, that our programs are built to encourage women to participate in them. So if you look at our teams, 60% of them or more are women from the communities. And I think that's been a critical part of the success. So it's a multitude of factors that have brought us to where we are today. And I think that you need all of that to get you there. And there's many lessons learned from polio and measles that say to you, go and tackle the toughest terrains first, don't leave it for last. And Mozambique being one of the countries with the highest burden, for us it was a great starting place to prove that subnational elimination of malaria is possible.
I was going to ask you why Mozambique, because that's where a lot of your work has been focused with Goodbye Malaria, and incredible results which you've just told us today. Can you expand for those of us that don't know Mozambique? Why is it one of the highest burden places? But also, can you give us a feel of what Mozambique's like?
It's probably one of the most amazing countries on the continent. It's got an incredibly long coastline. It was always seen as one of the poorest countries on the continent until they recently found gas in the northern part of the country, which has changed those dynamics for its population. But Mozambique, and as we know, malaria is a disease of the poor. And so Mozambique is a country that has frequent cyclones, frequent storms. There's a lot of water. Of course, that breeds the mosquitoes. They're an endemic country and therefore have a very high level of malaria. A lot of the population is out in rural areas with limited road networks, tough areas to get to. And so malaria has just flourished in that environment. Being a country with limited resource, the government has really struggled to get on top of the challenge that malaria poses. Of course, the likes of the Global Fund, PMI, they're big donors into Mozambique, and what's been incredible is the strides that they've taken over the last few years. There's a willingness to get to zero. Government has made a huge effort to ensure that access to testing and treatment is available to all citizens, and really have started to implement vector control, both in the delivery of nets as well as IRS within that community. So why Mozambique? Well, there's an expectation that we soon will get countries in southern Africa having eliminated and then eradicated malaria. The challenge for South Africa and Eswatini are imported cases of malaria, typically coming from our neighbors. Right. And Mozambique being one of the countries where we see a lot of imported cases coming through. So the idea is to tackle the disease at the source and then see the benefit occurring both in Eswatini and South Africa. And Eswatini is unbelievably close to getting to zero. I think they have less than 500 cases of malaria in the country. South Africa has seen a steep decline in the number of cases as well, but malaria is prevalent along its border with Mozambique and Zimbabwe. And so I think our program is looking to prove that subnational elimination can happen.
I think it's really interesting about the fact that you've gone and targeted the real source of it, because I can imagine there's a temptation, because you can achieve results, right? If you go to the less burdened countries, you can achieve results quickly rather than going to the source. So I think it's really fascinating to tackle those really high burden countries like Mozambique, like Nigeria as well, Uganda, rather than do it the other way around. How important is it that that Goodbye Malaria is an African organisation?
I think for us it's critical. When we started our journey, it really always took us to Geneva, New York, and Washington, and we felt that this is something we can definitely achieve at home. We understand the hurdles, we understand the challenges, we understand the culture. So I think it's important that we stood up and be counted within our own communities. And like I said earlier, the war against malaria will be won by communities taking ownership of the solutions. You know, we always talk about country ownership, but I don't think country ownership solely resides at national level at ministries of health. These are communities who can solve the problem, right? If you have a bed net, you need to comply and sleep under the bed net. Make sure you are protected. And that can only be done by the communities themselves. Of course, the new tools are absolutely critical to what we're going to achieve. But if we as Africans ensure that the implementation of those tools take place timeously, you will see a massive decrease in malaria on the continent.
It makes me think about some really young children I met, and they were like, I can't remember the phrase, but it was like, not in our community, not in our community. It just makes me think about that next generation not accepting it. You've worked in this for quite a while now and had such an incredible impact. What are your personal learnings from this? What have you learnt from this process? And to be able to, you know, anybody watching, to be able to implement in their fight against malaria?
I think there's certainly a willingness to end malaria on the continent. What we need to do is to mentor and upskill those communities, those leaders within those communities to get the job done. Within our ministries of health, we need to ensure that there's training, education, mentoring taking place. I think that the donors need to ensure that they creating capacity, not just bringing commodities into country, but truly creating capacity within those public health sectors. It needs good leaders. The skills are there within our communities to achieve this, but we need to take a step back and understand the roots that are going to drive the messages into these communities and get it done. Community radio, for example, is critical. You know, it's no use having a national an ad on national TV about malaria. That message is not heard. It's heard via a radio station at a community level. So I think we need to adapt our approach to the environment. We need to excite the youth to take this up as a challenge. You know, we speak about the youth in Africa. In South Africa, our biggest challenge is unemployment of the under 25s, right? How do we make malaria one of the causes that our youth take up? That we find opportunities for them, we create jobs for them. I mean, people are fearful that if they get involved in malaria elimination, they're going to work themselves out of a job.
Why is that?
I think people are nervous that, okay, I'm an IRS specialist, or I deal in the distribution of nets. If there's no more malaria, I don't have a job. And the challenge is exactly the opposite, right? It's you're going to become a skill set of someone who's eliminated a disease. There's many more challenges down the road. I mean, COVID has shown us the impact of a pandemic on our communities within public health. People are saying we've not gone past this and expect more pandemics down the road. And so the question is, how do we deal with that, right? And the capacity we create, the skill sets we create, will be able to deal with a public health issue regardless of the disease. And that's what we're trying to build. People understanding that sustainable systems of health need platforms from which these tough tasks can be done. And that needs a skill set that will be unique. Understanding how to get to zero will build a team that will understand how to deal with the barriers they faced with. For example, logistics and supply chains have broken around the world. How do we now ensure that our malaria programs continue, even though we're faced with not getting commodities on time? Just mentoring people into supply chain and logistics creates a system that'll work for TB, HIV, doesn't matter what comes next. And I think that's what our learnings have been, is that we need good leadership, we need capacity, and we need to continue to build the skills in our communities.
I love talking to people like you because I think we often think, I think I've probably said it before, so sorry if I sound like a broken record to everyone, but my learnings are that we often think in silos, but you've mentioned education, we've even mentioned, you know, the likes of football to engage, and we talked about unemployment and jobs, supply chain, you mentioned other diseases, we talked about women, female, you know, empowering females. I think there's the public health system. It's not just thinking about malaria down this one track. So what about moving forward and in the future, what it sounds such a basic question, what needs to be done, but we're seeing all these incredible organisations. You've mentioned Rollback Malaria, you mentioned PMI, the Global Fund, Your Goodbye Malaria. What, you know, but we're still seeing this rise. So what do you think needs to happen? I know we've covered a lot of things, but looking to the future, and I know it's not as simple as, oh, well, X, Y, Z. What do you think?
I think we know what needs to be done, right? I think we need to form partnerships between all of these organizations that really become laser focused. We've seen that daily data is possible. You know, in the world of malaria, the data that we were analyzing and making decisions on was 12 months old. That's crazy, right? How are you making a smart decision? All of that now is starting to change. We need to embrace technology more to make that happen. But it happens when there's collaboration and partnerships being formed by all of these organizations, and that we share our roadmap. And I think that if you look at the new tools that are coming down the line, we need to make sure that on the ground we have the right regulations in place, we have the right delivery mechanisms for it, and that we bring it to market as soon as possible. Is it not a crazy situation that we saw a COVID vaccine within months, right? What's it, 20 years for the malaria vaccine?
Yeah.
Come on, things need to change.
But do you think that's to do with the fact that there's this, you know, again, before the cameras were rolling, you said, you know, the UK needs to do more. Do you think maybe because COVID was this big international thing and affected everyone, that it got done quicker, whereas malaria is seen as maybe that's something that happens in Africa, and you also, you know, you've got to relate it to the poorest people that don't necessarily have a voice?
That's a very tough.
You're
That's a very tough question because it's a political nightmare, right? One of the things that COVID highlighted was the inequality in the world, where nations had many more doses of vaccine than was needed, whilst, you know, we down south were struggling even to get the first shot into the country. So I think that it's about building equity in place, part of which, and you asked me the question about Africa standing up for itself, part of which needs to say, you know, manufacturing needs to happen in Africa. We need greater access We need equality for what's happening. And the question you pose, well, was this something that was global and not just affecting the poor? That is a reality. But what we've seen is that philanthropy, the private sector, governments are stepping up to say, you know what, we need to find a way to bring the tools quicker to market. And I think the most important player in all of this, with whom the partnerships need to be formed, is the World Health Organization. Okay. So WHO is a critical partner to all of this success. If you look at us speaking about what should be done in high burden countries, WHO has a strategy for that, where they speak of, you know, the high burden, high impact plan. If you look at how do we deal with the issue of urbanization in Africa, WHO for malaria has come out with a new guideline for that. So I think that these partnerships need to be formed, but really driven in alignment with the same goal. And I think that's part of the challenge, is getting all of these organizations aligned and partnering to achieve the same objective. And yes, zero malaria is on all our minds. It's a message we all speak about, but sometimes I think our plans don't drive for the same result.
Yeah, it's interesting about the dates sometimes that are put on eradication and elimination. So in terms of zero malaria, do you believe that will be achieved in our lifetime? I know it's a difficult question.
In my lifetime, I'm hoping that is definitely the case. I think for me, we've heard 2025, 2030, 2040. Yeah. It's crazy, right? I think the message needs to change. We need to eradicate malaria now. And I think if we change our mindset and our time frame, we may become more ambitious. So for example, the Goodbye Malaria team, they think I'm crazy. I've set targets for them of, you know, zero local transmission in districts within the next 2 to 3 years. Forget about, you know, making it 2025 or 2030. Yeah. Let's do it now.
Yeah.
It's not like we don't have the tools. So yes, it's ambitious. There'll be those who think that I'm crazy and it's the wrong message to be putting out there. I don't think so. We dealt with COVID now.
Yeah.
We're dealing with many of the diseases now. Yeah. Why not malaria?
And it's interesting about the corporate mentality as well, because it made me think about going back to when you said about peri-peri sauce. Like, I bet you didn't go, oh, let's just wait a bit. It was like, no, let's get this out now. Let's build this brand. And it's such an interesting concept. I've never heard somebody say that. Why are we putting these dates on? Let's do it now. Like, because while we wait and go, you know, put this date on it, make sure it's achievable, it's completely preventable and treatable. And while that time passes, as we're sat here, children are losing their lives. How important is it to put that mindset and a corporate mindset to it?
It's absolutely critical. I think it's easy when you have a deadline to have many reasons why the deadline moves out. But in the corporate world, you don't have that luxury, right? It's a matter of getting things right and getting it done now. Yes, mistakes will be made. You learn from your mistakes and you move on, right? And success is getting more right than you do wrong. And so for us, I think the question of now is important. Let us put our full focus on getting there now, right? And yes, we have ambitious deadlines. Let's keep them. Let's not just find the easy way to move the deadline back. That should not be core to the mindset right now. And I think what was critical for us when Robbie and I started out on this journey, I mean, Robbie is just the most creative person I know, right, and has this amazing vision and believes that the world can be changed by creativity and design. And that's what malaria needs, right? More creativity coming in, more design coming in. I mean, a little bit off track, but the most amazing thing is, why have the number of women increased in our teams is we've made a better design of the spray tank that is more ergonomic for them to carry. It's things as simple as that, making uniforms that fit them better and that are built for women, not just finding a men's overall in
and
a
then
small
put it on a woman, which is
and
like,
say, here's your uniform. These are the things we need to change. And I think that by having the mindset of now, we will multitask and we will get the job done. We will look for the new tools. We'll encourage the new tools to come into the marketplace sooner and quicker. And we will encourage WHO to find better ways to get the processes moving quickly. And so I think that the partnerships will be critical, but I think it can be done now.
And there's no time like the present.
Yes.
Why wait?
Yes.
Can
indeed.
I read your T-shirt before we go? And everybody can have a read. If you think this should be the message to finish us off, I think, like, there's no time like the present. And if you think you're too small to make a difference, you've never, spent a night with a mosquito. There you go. That's the inspiration. It's always an absolute pleasure. Your drive, your passion is infectious, and thank you so much for sharing with us today. And it's great that we were actually in the same location. So
amazing.
we did this in person.
Absolutely amazing. And it's great to see you again, Charlie.
Thank you so much. Thank you for joining us for the Impact series. Don't forget, you can watch all the other interviews on the Vestergaard website as well. And we really hope that you can take so much inspiration from the conversations that we've had and continue this fight against malaria. Thanks so much, and we'll see you soon. Take care.